right, first up, let's talk about something that's taken over our social media feeds, chiropractors. We've seen the videos everywhere. There's a loud bone-cracking sound. People are looking a little scared when it's happening, but then after that, it seems as if they're relieved. And then you have captions that promise instant pain relief right after you get it. But here's the multi-crore question, as they say. Should we trust this trend that we're seeing everywhere on our body? Or could it just be another social media craze waiting to snap? Chiropractors are specialists, as they say they are, in spinal and joint manipulations. And their art, it's called chiropractic, is all about hands-on adjustments. The term itself, it's important to understand, it comes from Greek words. Those words means done by hand.
Yeah, pretty
it's fitting,
literate,
obviously, since chiropractors are relying heavily on these manual methods. The practice isn't new. It dates back all the way to 1895. When you had someone called Daniel David Palmer say that he'd cured a janitor's hearing loss by adjusting his spine. It sounds impressive, but did it really happen? Today, chiropractors operate in over 90 countries. The US alone boasts 70,000 licensed practitioners. And what that means is it makes chiropractic the largest alternative medical profession there is over there.
Largest there, imagine. But does chiropractic work, the science behind it is really supportive? Well, it's complicated to say the least. One British medical journal study found spinal manipulation or manipulative therapy, as they say, has similar effects to recommended treatments to chronic lower back pain. And here's the twist, as they say, quite literally. It also highlighted potential risks, including mild to moderate adverse effects. But what about India? What's the data here like? Now, unlike in the US, where bodies like the National Board of Chiropractic Examiners regulate the profession, India lacks any oversight. Many Indian chiropractors claim that US degrees and certification is what they have, but there is nobody to sort of verify those qualifications. On the flip side, however, physiotherapists in India are regulated under the Rehabilitation Council of India Act 1994, ensuring there's sort of a strict adherence to that code. So this story is not just about, chiropractic versus physiotherapy. It's about the right kind of both and understanding who needs what when. Our first guest this morning is Dr. Kannan. He is one of the nation's top sports physicians, somebody who has worked with almost all the international sports teams on the country as well in the last couple of decades. He's also the co-founder for SPARRC. So just to sort of get started with that, Dr. Kannan, what is sports therapy, just to sort of get a broad understanding there, and how is it different from physiotherapy or even chiropractic?
See, if you want to know, sports physiotherapy, sports medicine come under the banner of an allopathic practice that we have doctors who are studying in a medical college and physiotherapists studying in a physiotherapy or recognized medical colleges. So these are accepted specialities that are available in this country, in India, and around the world. You cannot change this. This is a mainstream of medicine. But when it comes to any form of chiropractic practice, it is alternative medicine, and they are totally different from the common impression of physiotherapy. There's nothing to do with physiotherapy. They work on a certain sector of the body and claim it to work in all the problems that they could solve.
I see.
Nothing to do with physiotherapy. Okay, so we'll remember that for our next few questions. Can you just tell us, Dr. Kannan, someone comes into your practice, say I'm going to give an example, say they have an injured leg. How do you analyze what kind of therapy should be given to them? For example, what branch even within physiotherapy should be advocated?
First of all, is the history that we need to elicit optimally. A person may have a pain which is there only when they walk. This would be a common impression. But if you ask them, while walking, I don't have a pain. After walking, I get this pain. So the impression that we get that walk produces pain is not true. Post-walk, the pain has been present. So they blame it on the walk. So in sports medicine, we are clear about whether there is no injury and the pain has come, or an injury has caused the pain. So if there has been an injury, instantaneously and immediately the pain is felt. Then the injury has caused the pain. If the pain is coming a few days or few months later, still there is an initiation, but it is not caused by that alone. There are other factors which are also in connivance with each other to produce the result. This is one aspect. Now, when it is handed over to the physiotherapist, they are given a clarity on an injury that has been diagnosed and given to them for their management. It is fair enough in most of the conditions to let the physiotherapist do what they need to do, because they are trained in the physiotherapy sector to take care of with the gadgets, which involves the ultrasound, the electro modalities that we talk about, ultrasound, IFT, shortwave diathermy, traction, whatever form of therapy. And they also today have mobilization and manipulation therapies, which have been taken into physiotherapy and understood that they will not cause injuries to a person.
I see. So switching back to chiropractic for a bit then, Dr. Kannan, are there situations where you do advise people to take sort of sessions from a chiropractor?
Ma'am, chiropractic practice is not a mainstream. So in this country, in India, we do not advise anyone to go through a chiropractic practice because they are not people who are licensed in this country to practice. They may be very good in their job, they could have earned their license elsewhere, but there is nobody controlling their practice in this country. Even a physiotherapist is coming under a certain scrutiny in this country. And if there is any legal action, there will be no protection at all for the chiropractor. All the other things that you asked me, whether it's physiotherapy or sports medicine, come under these categories. So I wouldn't advise anyone to go for a chiropractic because though I know a concept how it works, but who is practicing this in this country with what qualification? There are no schools in chiropractic. There are only schools which come from outside this country and teach it not to people who are in the 12th standard, finished their program. They're teaching it to physiotherapists who have finished their practice or are trained already to practice. They are physiotherapists. So they are adding chiropractic practice to them. So nobody who is a non-medicine person learning chiropractic like outside the country gets to learn it here. There are only physiotherapists who may practice, thinking that could give their extension of what they can do to this person.
Dr. Kannan, if we could ask you though, as we were starting the show, we told our audiences a little bit about what chiropractors say is the science behind it. They call it spinal manipulation, right? And you're someone who, because you've been in this field, I'm sure you've delved deep into the science behind what is called chiropractic. So, you know, by cracking something, you are changing the alignment of the spine, and that is to benefit. I know some chiropractors actually say, and this is more abroad than it is here, that it can even cause diseases. They say even things like asthma can be cured. What do you have to think of the science behind it?
See, when Daniel David Palmer, D.D. Palmer, the origin of us chiropractic medicine, they were called as bone setters. They were not even near anything. They were just setting bones in 1907 perhaps. But when they came out with the second patient, William Weed, who gave an idea, why don't you call that as chiropractic? Because chiro refers to a Greek name. This is how they didn't even have a name, they got a name. Now, they are talking about how you can have subluxations on the spine, which is a vertebrae below the skull, which may lose their position either forward, backward, sideward, inward, rotated, etc., tilted. And those malalignments may lead to pain, dysfunction, diseases of all sorts. So The whole idea of the spinal mobilization and manipulation is to ensure you restore the alignment back to its original level, if not in one go, by a series of treatment, such that you can have a person pain-free or a disease-free state. This is
Sure.
what it is. And in which the science does not have a clarity like the way our medicine allopathic practice is, where you are having a clarity on this manipulation, you will see this. Okay? It seems to be vague and doesn't have clarity in attaining the result that we have in this many days or whatever.
Okay, your opinion is pretty clear, but let me attempt to ask it one more time. All these cracking videos that we see of chiropractors, not just in India but abroad as well, with little kids, you see qualified nurses, certified nurses in their, official attire, carrying on, these adjustment activities. So, what is your thought on chiropractors?
See, we can get us noise. All of us do this, crackling our knuckles on a day-to-day basis. And sometimes you feel somebody doing this, and we get even now you got a crack from my own shoulder. It doesn't mean that till date we don't understand why a sound comes from which space. We know it has come from a space, we don't know which structure produces it. There's a nitrogen bubble that seems to come out. There are various theories. When there are theories, we don't have an answer. So most important component is we don't know where the sound comes from. The sound doesn't mean there is a pathology underneath. That's why this is happening. There are children with this kind of sounds who have comfortably, done whatever they were doing, to a geriatric age group who would seem to have it. World-class athletes have it, and it doesn't mean the sound means anything. So a crackling sound that a chiropractic makes and claims that he has realigned the spine is very difficult for us to understand. How much time will it take to go back to its original position where a realignment has to be made? What are the forces that create this malalignment? Is it the person's posture? Is it anything that we could correct without the manipulation? Is not understood. And my suggestion is, if we have a chiropractic person, the individual has learned from any particular school outside the country with their certification. They are practicing 200 hours more than the normal physicians who are coming out of the medical college, if they have a licensing. So you must know something about what they do before you even give your fingernail to them rather than putting your head.
Okay, Dr. Kannan, if we could just ask you then, lastly, are you seeing people come in? Your center, SPARRC, as we talked about it earlier, it offers all of these services. So not chiropractic in particular, but it does offer different kinds of physiotherapy. Do you see people coming in and asking for chiropractors too? Is that a demand or question people make?
In my practice, I don't see. I see them when they had already met and things didn't go well the way it is, or they got better, but it was not sustained. Most of the work is they are doing a kind of a therapy, but it doesn't sustain because whatever that they could have done gave them a partial relief, or mildly aggravated the symptom, or severely aggravated the system. A complete cure has not been a common feature in this country, at least as I have seen, with the kind of chiropractic that is available.
All right, Dr. Kannan, thanks so much for joining us. We've spoken to a true blue physiotherapist. It's only fair we give chiropractors a chance on the program to make their case. Dr. Saurabh Mangal, Director of Health Science Physio Wellness Clinic, is also with us. By the way, all the details that you're seeing on the report are actually by our colleague Himani. You can watch and, in fact, read the entire report on News18.com as well. Dr. Saurabh, let's start with this. Chiropractic not to be recommended. People are going to physiotherapists after things have gone wrong with the chiropractor. All these claims have been made. So let's give you an opening comment first to make your case.
Okay, what I'll say that people are coming to us not because they have done the things incorrectly in the chiropractic clinics, but they come because it is not benefiting them.
Okay.
So people come to us and they say we went to the chiropractor for back pain, we felt the relief for just 10-15 minutes, and once we came out of the clinic it was same. So there was no relief. That's why they come back to the physiotherapy.
But Dr. Mangal, if we could ask you, you are also a chiropractor, correct? You are someone who has been practicing the chiropractic science for at least the last 7 years.
Also doing physio. He does both.
Also doing physio, exactly. But that's exactly what Dr. Kannan said earlier, that chiropractic as a science is practiced by those who are physiotherapists who then take this up. Why did you decide to take up chiropractic after being a physiotherapist for many years? What was your shift there?
In physiotherapy, we get lots of patients with the different problems. Our main job is to let them get out of that pain position by using different kind of modalities. Like we use electrotherapy, we use manual muscle mobilizations, we use stretchings, we use exercise therapy. Nowadays, we are using dry needle therapy as well, where we use that acupuncture needles. This chiropractic thing is also a part of physiotherapy, as we can say, because these are the manipulations. In physiotherapy, we practice low volume. Like we just practice the manipulations, but not like that cracking sound. But in chiropractic, we practice in the high velocity. So if I say the both things like manipulations we are using in the physiotherapy and high velocity manipulations used in the chiropractic, they are almost same. But that low volume manipulations of the joints benefits, but this high volume just gives the relaxation. So I'll say that chiropractic part comes for the relaxation only.
So you're making the distinction very, very clear. Number one, it's an alternate therapy, does not replace physiotherapy, and it is only for instant relief, not cure. So that's important to remember. Not to see it as an alternate therapy, not to see it something that will cure altogether. It is only to give you relief, which sounds okay. That clarifies things a little bit. But you know, my question is this: why is there so much sort of at one hand a lot of viral videos of chiropractors going the rounds, and on the other doctors saying, listen, stay away from it. When in a place like India, where traditional massage and you know, very age-old ragda massage used to be like a thing, in a country like ours, how does this go back?
Look, people, if you see nowadays from last 2-3 years, people are more into social media. So whatever you see in the social media, if you see the reel and if you're sharing it, social media will hype that. So when people started to post these chiropractic techniques and these cracking sounds on the social media, it took hype. And now everybody's seeing the videos and they think that, okay, I'm having back pain. Let's go and try this. So people are going there by the chance. Okay, let's give it a chance. If I get benefit, it is okay. If it not benefiting me, I will go back to the physiotherapy.
But is it a chance worth taking, since there are some instances also?
So that's exactly, Dr. Mangal, I want to ask you this. I think the strongest point that Dr. Kannan, who we had right before you, he was making, is that physiotherapists are regulated. In India, there is a body that regulates physiotherapists very strictly. The same doesn't exist for this practice, for chiropractic. And so what you could have happening in many cases, which is so important because you're letting someone come in and play with your body, is that there's no regulation, and that's actually quite dangerous, wouldn't you say, doctor?
Yeah.
This is a very dangerous technique, and as we have seen it on some videos also, like there was a case, and I think it was in the USA, one chiropractor just did the manipulation on the neck of a patient, and that patient was paralyzed after that. And recently one video was trending on Instagram that one person was sitting on the barber salon, and that barber did the manipulation of neck crack, and he was like this in that position. That was fake, but these cases happens. And in my own city also, I have seen one case in front of my eyes. I sitting in the salon, one man came, he said, my neck is stuck from the morning. That time I was in school. So that barber said, okay, I can adjust it. And he was adjusting it from many months or years for other persons also. But that day, in front of my eye, he adjusted it. And after 30 minutes, somebody told me that man who got his neck adjusted is no more.
Oh, God.
So this is the real case. This is the real case in front of my eyes that I have seen in my school time. But
Right.
but if you see in India, you will see these techniques are being used in ancient times also, and like in rural villages, still people use. If somebody is having back pain, they ask them to lie down on the floor, put your leg that side, and they kick them.
Yeah. Yeah.
So these
Dr.
techniques we
Saurabh,
use.
sorry, we're running out of time, so quickly I want to squeeze in a question. You know, you seem to have a balanced view on things. You're saying you yourself do chiropractic, but you're saying not everybody does it the right way. So what's your recommendation for people? The difference between instant relief and long-term repair is clearly established. But what is your advice when people say are looking at chiropractors?
I will say this: for the long-term effects, you should go through physiotherapy only. And if a physiotherapist want to do the manipulations at the right time, that is a good idea.
Right.
Instead of just going straight to the manipulations, because manipulations can harm you. But with the physiotherapy, if you are using it, it will not harm you.
Right. All right, Dr. Saurabh, thanks so much for joining us and clarifying that completely for our viewers. Well, go to a certified one. That's my only go-to. And please take proper recommendations. And please ask your doctor before trying any of this. That's a big disclaimer coming there. Thanks so much for joining us with that.
Start with a physiotherapist. I think they both were in agreement there. Okay, we're going to head into a quick break. On the other side, we are taking you to the reality in the NCR region as Delhi air quality has dropped to severe once again. It felt like we were out of it, but it doesn't seem like we are. We'll have the numbers for you on the other side. We'll see you in just a few minutes.